Now, the health department is calling for vigilance after a second laboratory-confirmed case of cholera. Shockingly, the department says the cases were imported from Malawi. As a precautionary measure, port health officials will now be on alert for travelers arriving from countries that are experiencing cholera outbreaks. Let's discuss the latest now with the Deputy Minister of Health, Dr. Sibongiuseni Dhlomo. Dr. Dhlomo, good afternoon. Welcome to Today on eNCA. The statement that was issued by your department says there's only been 2 laboratory-confirmed cases of cholera, which were imported, unfortunately, from Malawi. The emphasis on laboratory-confirmed would suggest that there could be more cholera cases that have not been found yet. Am I wrong?
Good afternoon to you, sir, and good afternoon to your viewers. We hope not, but this caution and the alert that you are actually giving us a space to talk about is that if it's not necessarily even if you have had a history of travel, because you might have been in that bus and you probably might have been, the spread of a communicable disease like cholera would be if I get to be infected by a contaminated product from you. Either I touch your hand, you give me food from your hands where there's not been washed hands. So it could be more, but we are not really there at that stage. All we are saying, if you could have someone with diarrheal diseases, let's probably err on the side of let's go in there and get checked, because you can get dehydration quite fast and then have challenges. But it's not all cases of cholera. Cholera sometimes is very mild in most people, but sometimes you may never know who else is going to get a mild one or a severe one. Yes.
So you are saying if you know somebody around in your household today in the Johannesburg area, for example, who's got diarrhea, they need to get checked?
Not necessarily. I mean, a lot of us do have, at least you may not have water in your house. You do have water, at least in the tap, in the community, even in the informal settlements areas. All we are saying that let us strengthen the washing of hands with the soap or sanitizer when you come in from the bathroom, when you are going to be preparing food or giving food to people. But for those who are probably getting water from resources that are not as clean, safe water like the taps, then you could even do more. They sometimes boil the water to kill the bacteria or the virus in there. But we are not saying everybody now who gets this who is in Gauteng must be tested for that. Not at all. It is a spread through contact with a food product or hands of someone else who has actually had the cholera in his or her hand.
Yeah, and it spread roughly, mainly, as you said, through contaminated water. So that's why you're talking about boiling your water and looking after your water.
Yeah, it's a fecal contamination because if you have, me and you have got a Vibrio cholera, it will be in our gut. If I actually have it in my gut and I go and pass it on, but when I come back, I shake your hand, I don't wash your hands, I prepare food, then it can spread from the fecal contamination that I have into the food products that other people will enjoy.
Is it fair then to say that you are on kind of a public alert, a health alert?
Yes, because according to the rules of WHO, Vibrio cholera infection is something that you should hide. We are actually saying, because we are still tracing, there are people in the bus with the 2 sisters. They may or may not have been infected. We need to know where they are, what are they doing, what happens. The family, the 2 sisters also came in and stayed with some people. Yes, we have to follow that part and see their track and cover. In the same way we're doing for COVID, where were you, which plane were you at, which bus were you at, follow up. It is a contamination that can spread through that. Did you share any fruit with anybody in the bus without washing his hands or her hands? That's a story. So you are right, potentially maybe more than 2, but for now we don't have that information. But we are actually on an alert and making sure South Africans are aware that we have had these 2 cases of the 2 family sisters coming in from one household in Malawi. Of course, Malawi being one of those endemic areas with cholera.
Okay, so you're doing what you're required to do as public health officials when there are cases of cholera being detected. Can I ask you about measles? Towards the end of last year, in fact, between September and December last year, Dr. Dhlomo, we saw a number of cases, several hundred cases of measles in Limpopo, in Mpumalanga, in Gauteng, and other parts of the country. And I interviewed a number of health officials, including the MEC for Health in Limpopo, about their vaccination campaign. Where are we at currently in the country as far as the spread of measles is concerned?
We took up that campaign very strongly, and you are correct. It is actually on the provinces. I'm glad you are raising it. Gauteng, Limpopo, mainly Limpopo and Mpumalanga. Provinces that are bordering some other countries. We have improved our vaccination on measles, but if you do get relatives across the border on the other side whose vaccination status may not be that good, that's why we went on strong also on the boosters. So we need to actually up our game so that we are at least vaccinated up to 90%. Because if you do so, then you are really sure that your immunity is actually permeated to many children. But we strongly did that around December, holidays, picking up just before open. I don't know the latest statistics, but MEC Limpopo, MEC Mpumalanga, they were very much aware. We want to strongly support their efforts. That was, if those provinces on the border are strong in vaccination, then we will be home and dry in terms of decreasing the numbers of measles outbreak in our country.
Okay, the other point I wanted to raise with you, Dr. Dhlomo, is about exemption of hospitals from load shedding. We're still very much in the throes of high stages of power cuts by Eskom. Have you managed as a department to secure an exemption of public hospitals from load shedding?
We have, but not adequately so. It depends on the grid and the connectivity, because while we want to isolate the hospitals, but some of the hospitals are community-based, and therefore you probably would then, Eskom would say, but if I do exempt you, there is a whole host of other 202,000 houses that are part of the same grid or same connectivity line. So those that were able to be isolated quickly and faster have already been identified, but we would want to increase and improve on many more other hospitals being exempted. The challenge is in the infrastructure separation of them from the rest of the other areas where they should still be getting load shedding.
Okay, Dr. Sibongiuseni Dhlomo, thank you very much for your time this afternoon on Today here on eNCA. He's, of course, the Deputy Minister of Health.